Dr. Schwartzbard?
Yeah,
Hi, this is John Fernandez with Baptist Marketing. How you doing?
I'm good. How are you?
Good. Do you have a few minutes now? Or?
Yeah, now's a good time.
Fantastic. I appreciate it very much. I know you're crazy busy these days. Um, I know we've gotten a lot of chatter on social media from pregnant women who are, well, as you can imagine, concerned these days.
Yeah, I can imagine.
Yeah, and I'm sure you've run across that. And I know there's a lot of unknowns regarding COVID-19 and COVID-19 and pregnancy. I know the CDC is still stating that, I think I have it in front of me here, we do not currently know if pregnant women have a greater chance of greater chance of getting sick from COVID-19 than the general public, nor
Right.
whether they are more likely to have serious illness as a result.
Right.
That said, what's, I guess, your primary, let's start with your right now, pregnant women who are out there very concerned and anxious,
Right.
particularly those maybe in their
So,
third trimester. I mean, what is your general message right now for them?
right. So, you have to give patients like a very balanced answer, I would say. So, we do know that pregnant women's immune system is in general suppressed. So, we know that with other types of viruses like influenza, pregnant women are at higher risk for getting the flu and getting sicker if they get the flu. So, with that being said, you are in general more concerned about how a pregnant woman might respond with something like coronavirus. So for sure, patients ask, that's what I tell them. You want to take not just the general precautionary measures, but you really want to be extra precautionary, I would say. But at the same time, on the flip side, like the very minimal data that they've had that's come out of, I guess, China, preliminary studies, that, they have not seen anything more, concerning with pregnancy. So, at the same time, that is reassuring, but I do definitely tell my pregnant patients, take all of those CDC precautions, the social distancing, washing your hands, staying away from anybody who might be sick, and all these recommendations that the CDC is giving for the general population, and then honestly try and take that up a notch.
Right, and I know you mentioned that. I think the study was written about I was reading on NPR.org just a couple of days ago that there was a study out of Wuhan, China, a very small group of pregnant women in their third trimester, and they had tested positive, but they didn't have severe illness, and their babies were born healthy.
Right.
But that was a small study, and I guess that's reassuring, but I guess if you read that, you still have to take all the precautions that maybe a little more so. Would you say that pregnant women are a slightly higher risk because of their immune system being somewhat overworked or reduced or?
Right. So in general, that's what we know about pregnant women is that their immune system is suppressed. So that's what we've seen with other viruses such as influenza. So it is logical to think that they would be higher risk with coronavirus, even though we have not seen that to a significant degree, but it is so early in the disease process. But so far in hospitalizations and pregnant women getting corona, we are not seeing them getting sicker per se so far. But I am recommending when my patients ask, like I said, to really take those precautionary measures and to an additional degree.
Right, and I also read with very much interest a pregnant woman who posted on social media that she had some cold-like symptoms, didn't have a fever, and then all of a sudden she lost a bit of a sense of smell and taste, which is now starting to come out as possible symptoms of. And she tested positive, but was symptoms are she's on. What should if women start if a pregnant woman starts feeling some symptoms that may be, fever, maybe a cough, that the symptoms that are aligned with COVID-19, what should that person do? What should she?
Right, so they should reach out to their personal practitioner. Testing is available. I mean, I'm sure people hear in the news we are having issues with tests being available, but depending on where that person is, we do have testing available. Patients do meet that criteria. I mean, and the problem is a lot of patients are not going to want to go necessarily to an emergency room type setting to get that test done. So if the symptoms are relatively mild, you just may recommend that they actually stay home, and if they're able to just treat their symptoms. If it does warrant an evaluation, then they're going to have to come in and be seen.
Right. So if it's slightly more serious, they should probably call their doctor.
Exactly.
Before coming in.
Yeah, don't hesitate to call your healthcare professional. But as far as coming in to be tested, that will be discussed with the healthcare professional.
Okay, fantastic. And I know that stress and anxiety that we all feel now, is probably maybe a little harder on pregnant women. That's probably it's not healthy for anyone. But what would you say about handling the anxiety and all that to pregnant women now? And I mean, in terms of
right. I mean, at least most of the data, as little as it is, nothing has come out that, if you were to get COVID-19, that we are seeing any harmful effects on the fetus. So, I mean, when we're talking about coronavirus, part of it is like the health of the mom, right? If you're pregnant and you get sick, we have those concerns. And then the other concerns are the risks of the actual fetus. So as far as all of that data goes, nothing is coming out that is seeming of significant concern. So that should hopefully be reassuring. But even non-pregnant people are walking around very anxious and stressed at this time. So, yeah, you just have to do the best that you can and, reach out to, your normal support system.
Okay, to your normal support folks normally that support you and stay calm. I guess like everyone should, or
Exactly, and probably stay away from the news.
That's right. Well, yes, that's what Dr. Rohidi said in a podcast about mental health. Maybe you should reduce the coverage, following the coverage of the news for several hours, especially before you're going 2 hours before going to sleep.
I mean, doing all those general well-being type activities, stay in as much of a normal routine as you can, try and stay active, eat healthy, and keep the TV and the social media off.
Okay. Anything else that I didn't cover that you want to add, or I think we're good?
I think that's good.
Let me, I'll put something together, hopefully maybe by tomorrow, maybe in a Q&A format that's simpler for folks to read, as we did today with a story about an article about cancer patients and COVID-19. They're nervous too, obviously, but and I'll send you what's your email so I can...
My Baptist is Ellen, ELLEN, my first name, and then SC at Baptist Health.
Okay. Thank you very much, Dr. Schwartzbard. I will be in touch. Thanks again. I appreciate it so much.
Okay, no problem. Have a good evening.
Take care. Bye-bye.
Okay, bye-bye.